One.
Good morning, everyone. It is November 25th, 2025. We'll call the November Board of Health meeting to order. My name is Deanna Diamore, the Director of Health. Present, we have board members Frank Ehrlich, Norman Weinberger, Ken Lalim, and Anthony Santella. And we have staff members Aniela Fignon, Teresa Argandesi, and Brian Weeks. The next item on the agenda is the acceptance of the minutes from the regular meeting of October 28th, 2025. Do I have a motion for the minutes?
Yes.
Okay, I think Frank, and then I think it's about Anthony the second. Um, are there any discussion, any edits that need to be made on the minutes?
No.
Thank you. All right, I'm gonna call for a vote. All those in favor say aye or raise their hands.
Aye.
Any abstentions? Any nays? All right, they passed. Thank you, everybody. All right, next item is public participation. I will open it, but I don't see anybody who's attending. So we will close public participation. And then we'll move on to epidemiology updates. So good morning, Brian. Thanks for being here today for the update again.
Yeah, good morning, Deanna. Good morning, board. Good morning, everybody. So yeah, it's just gonna be a simpler update because as we know, Thanksgiving week. This is Thanksgiving week, so a lot of social gatherings, but also it is the real kickoff to the respiratory illness season. So that's the point I'm just gonna hit home here, which again, sit back and enjoy the ride because you guys, I've heard this many a time, but we're just gonna do a quick update and check in about that. Um, so just to share the screen. So this is again our favorite CDC respiratory illnesses data channel. So everything is back now and it's up to date, thankfully. After the government shutdown, there was a point actually where the wastewater monitoring disappeared for a little bit, but now it's back. So it's great to see this kind of in operational state, as it was like before the shutdown. So with that said, zooming into Connecticut right away, our respiratory illness activity situation is at low. And so again, looking at for severity of illness, so that's our emergency department visits in Connecticut. We got COVID-19 at very low with no change, flu and RSV at low, but flu at increasing trend, which is again par for the course, and no change for RSV. So if we look at the wastewater monitoring, which is a better indicator kind of what's going on behind the scenes, and again, a predictor where things are going to go, that is COVID-19 is at low, flu and RSV are at very low, but that means it's still in the community. And, with other kind of wastewater monitoring surveillance, we do have that confirmed that it is in the lower Fairfield County, all three of those big three. And so it's just important to kind of keep in mind that we are dealing with this. It's just that, again, Thanksgiving is going to be a real kickstarter to it. So, just as a reminder, there's other obviously respiratory viruses and illnesses circulating out there too. And so this is again looking at it from the national perspective in our NRE VSS dashboard. If we look at the up-to-date data on the right-hand side here, again, rhinovirus and enteroviruses are the highest proportion in terms of weekly percent positive tests. But that is then followed by parainfluenza virus, which is again, kind of par for the course for the season, but it's something else to keep in mind that's also contributing to illness and potentially hospital visits too. Then along with that, the SARS-CoV-2 situation, which as you can see, nationally speaking, is lower where we were in terms of the peak back in September, but it's still circulating, as we know. And as I keep hitting home, we're going to be hitting the catalyst, or this is the catalyst this week, for things to pick up. So the other thing is, and you've probably seen in the news too, this is just like one news article in regards to it. It's influenza type A, H3N2 subclade K. So this has entered the picture, and it was after the fact in terms of the flu vaccine formulation. Although again, the vaccine will be protective in terms of reducing hospitalization and other kind of worse outcomes. Subclade K is having great success in terms of contributing to illness in the EU, as well as it's been showing up in the United States. And so keep in mind, H3N2, we always deal with every season. It's just this is a new subclade of it. But it is known as the hospitalizer. So it's something we gotta just, kind of buckle up for as we anticipate with any respiratory illness season. So just want to put that reminder out there. I'll also mention, just really quickly, there was also the first human case of H5N5, which is related to human influenza. That was in Washington State. that individual was, higher risk in terms of pre-existing conditions as well as experiencing immunosenescence, older age, and so waning immunity. But at the same time, this person was also maintaining backyard flocks of poultry, so that was a contributing factor in terms of exposure. So it's just, again, just an important reminder that we do have avian influenza out there. Again, this is very low risk to the community at this time, but it's something we want to be mindful of is also circulating that can contribute and potentially complicate our respiratory illness season, which is again why we go to our favorite infographic really quickly for respiratory virus guidance from the CDC. So again, our immunizations, like for flu, COVID, RSV, etc., as well as the complications associated with that too. Um, the vaccines that exist for that. And then along with that, hand hygiene, respiratory etiquette, steps for cleaner air, so the air filtration, as well as just opening up windows where you can. But obviously, this weather's not been the most conducive towards that, and will continue that way with the winter. Treatments, so flu antivirals, COVID antivirals, things of that nature. But then staying home, preventing that spread. That's the most important thing anybody can do. So wait until one's symptoms are better, fever free, without any sort of fever reducing medications for 24 hours. Then taking those additional precautions with the masking, the distancing, avoiding those social gatherings where appropriate, where it can be a lot of risk to exposure if obviously one is determined to be ill. And then along with that, testing to kind of confirm that. So that's those rapid tests that we're all familiar with. So again, you guys heard this a million times, but I just want to kind of hit this home because this is very important for this time moving forward because it determines what sort of season we experience. And again, Norwalk is not a silo, so we all contribute to what is the national and international respiratory illness situation as well. And then I'll just throw in a quick reminder about measles just to check in where we are at. So this is the CDC surveillance for the year 2025 at a national level. We're at 1,753 cases. 12% of them have resulted in hospitalizations. Three deaths so far confirmed per the CDC. Again, the point I'm hitting home, and this is why I initially honed it on this infographic or chart, is just showing the trends and just the weekly number of cases by rash onset date. So it is holding steady, if not upticking slightly. You got to keep in mind the most recent couple of weeks. There's still further confirmations that need to come, get confirmed. So the data is provisional, so that's why it looks like it's dipping down, but it's not necessarily the case. So we just want to be mindful that we are still dealing with this in the midst of everything else. And a bunch of other things too, but just kind of prioritizing a reminder about vaccine preventable diseases. And so again, that also ties into the respiratory illnesses too, where appropriate. And so just a reminder about the measles vaccine. It is offered at our health department clinic. More information can be found at the norwalkt.gov/1822/measles webpage. Obviously, the guidance in terms of receiving the vaccine, who's eligible, things of that nature too, as well as those questions can be forwarded to the health department. So just want to kind of do a quick overview related to that. Just also a reminder about travel health too. If anybody is traveling, just check in on the country if you're traveling internationally, as well as just monitor what's going on, even at the national level in certain states, if they're experiencing something unusual or something else to be considered there too. So I think it's just important that everybody just stay informed. And, CDC does really have an excellent website for travelers' health. And then we also have our own travel health clinic here at the health department. And so just a little promo there about the flu vaccines too, but also just, can follow up with us about travel vaccines and the ones that we offer, the schedule for that and everything else. So all this information here is again at the travel health clinic here at the health department. So just throwing those plugs in there. So again, as a summary, it's tis the season, respiratory illness, right now for respiratory illnesses. This is going to be our big uptick with Thanksgiving. Do everything you can to prevent illness and spread the word, not the disease. And then along with that, measles too, just stay up to date, spread the word as well. And then along with that, just do your precautions relative to travel health, just so you don't run the risk of exposure and then bringing something back. Because there's a lot of other things going on, like with Ebola and other things that are going on internationally that we want to be mindful of, very specific and endemic in certain areas. But again, we want to have that resolved and closed out as soon as we can. So that's just a reminder about that too. So, all right, that's it for me. Have a great Thanksgiving, everybody. Really appreciate it.
Thank you so much, Brian. Does anybody have any questions or comments for Brian? All right. Thanks again. Um, I asked Teresa to give some updates about the food access work that she and her team are leading, and also to give a quick recap of some of the efforts over the past month. So I'll pass it on to Teresa. Good morning, Teresa.
Good morning, Deanna. Good morning, everybody. So yes, I'll do a quick overview. I don't have any slides or anything, but first I just wanted to give a big shout out to Kelly Tomlinson, our health educator who leads this work and pulls all the partners together and coordinates all of these efforts. So you may know we lead the Norwalk Food Alliance. That is a coalition of over 30 food agencies and other organizations looking at nutrition security in Norwalk. The coalition was formed in 2019 to help improve the overall food system in Norwalk. Much of our work in the group is about coordination, alignment, communication about, existing resources. For example, we created the first Norwalk food guide, um, and we keep it updated and we disseminate it out to the public. So it's a collection of a lot of different food resources, whether they're pantries, mobile pantries, SNAP enrollment assistance, our WIC program, a lot of resources that are already available to folks who are looking for food and food services. And that's at a short URL that we have on the website, norwalkt.gov/meals. It's available in English, Spanish, and Haitian Creole. And so we have been Kelly's been working diligently to keep that updated. It is updated twice a year at minimum, sometimes more often. And so a lot of our partners give that out as well, so that when they're seeing clients and the clients need additional food resources, they're able to refer out to other partners. Also, we're currently conducting intercept interviews and focus groups at some of the local food pantries and food agencies in Norwalk. We're trying to better understand client experience and get community voice and input into how to make the existing food resources even better and what gaps there are in the system. And then Kelly, again, our health educator who leads this work, she now serves on several regional and state coalitions and groups to help represent Norwalk. The food security system can be a little bit fragmented throughout the country and in the state, and so we're very happy that Kelly has been able to work and join some of those collaboratives so that she can bring the Norwalk perspective into their planning and into the conversation, but then also bring back information, news, resources so that if things are happening at the regional, state, or national level, we want to make sure we're aware of it. So in addition to some of that regular food access improvement work that we've been doing, having the Food Alliance in existence has helped us mobilize quickly in the event of emergencies, emerging threats, those kinds of things, as was the case with COVID, and most recently that pause in SNAP benefit distribution earlier this month. So during that time, we were able to get immediate feedback from partners. In fact, we had a scheduled Food Alliance meeting the morning after the Department of Social Services had announced that they had been informed that November benefits would not be distributed. So we were able to almost, within 12 hours, be able to really talk to the partners about what that meant for them and what they thought actions at the local level should be. And then you may have seen soon after that announcement, the mayor's office organized a press conference and pulled together several of the food partners that are part of the Norwalk Food Alliance. And we were able to get the word out about some of the efforts that were already happening in the community and some of the support that was needed. And so the health department and the Norwalk Food Alliance were working to disseminate information that was coming out of DSS about what the guidance was, what was about to happen, what that meant for clients and for agencies. And then also pulled together and created some messaging with input from our partners about what the public could do to help, right? So we wanted to let clients who are looking for food know and were concerned about not getting their SNAP benefits, let them know where to go for additional help. But we also wanted to let people who had access and means to know what are the things that are most valuable to help the food agencies in Norwalk. And so having the Food Alliance in place, having them see the health department as a convening partner, really helped in that effort to try to pull everybody together, and mobilize. So in looking ahead, this work will also be really important as we, as a state and as a nation, try to navigate the changes to the SNAP program as a result of HB1, the big bill that was signed over the summer. There are several changes that will be coming as a result, or that have been put in place as a result of that bill. And so we're working with our partners to currently parse through all the information and determine how Norwalk will be impacted by those changes in work requirements, eligibility, exemptions, some of those things, and then what local action we can take to make sure that people still have access to food. So, thank you.
Thank you, Teresa. It's incredible work that you all are doing. So thank you. And to me, it's just a great example of having those partnerships and strong relationships and the coalition and everything, the lines in place already to then be able to respond when needed and support each other. So just really incredible work. Does anybody have any questions for Teresa? Anything to share? All right. Next on the agenda is the 2026 meeting schedule. So we may remember that every year we set the schedule for the next year. So like by beginning of December, I believe I have to send over all our meeting dates to the mayor's office and city clerk's office so that we can set the agenda for the entire year. And we can still meet at different dates, but those will be considered, they would be considered a special meeting. So for FOI rules requirements, we have to set the meetings for the entire year. So just wanted to check in. I can also email and do like a doodle poll or gauge what people's availability is. But do we want to keep the 8 a.m. meetings fourth Tuesday of the month, except changing it in case there's a holiday or something that conflicts? Do we want to do anything different? Do we want to explore anything different? Just wanted to check in with you all, see if you had any thoughts.
This schedule works for me.
Thanks, Mo.
Same. I mean, I'm fine with them.
Thanks, Anthony.
I'm fine.
Thanks, Frank. All right. Any thoughts, Ken? Are you okay with it, or do you want to? Think you're muted right now. I'll also follow up with Joan and Janet afterwards, and Ken, I'll also follow up with you too if you have any thoughts, so we can and then I'll email everybody. But we can put some proposed dates. We'll take a look at all the holidays too to make sure there's no conflicting ones. We'll send it out. Thanks, everybody. The last item was just the director's report. So it's budget season again. Seems like all year round it's budget season, but we're working on. Oh, Ken, you unmuted. Do you have anything to share related to the?
I've been talking here. No, I'm fine.
You're good with the Tuesday. Okay.
Thank you.
Thank you, Ken. So we're currently working on putting our operating budget request together, and we're going to be putting it into the financial software. And then that, begins the process to then to review it with the CFO and the mayor's office and leadership. And we're working really closely with Lamont Daniels, who's our chief of community services, on the budget. As you know, now we're, as the health department's part of the community services department, they look at the budget as a whole, like the health department, human services, the library, how we all fall in together. So we're working on that. And then we decided not to put any new capital budget requests in for this year. We still have some ongoing projects that we're working on, including, security upgrades and enhancements. We're going to, as you know, we've been working on the exam room, so we want to continue some of that work for the rest of the first floor with some painting updates, some upgrades at the reception desk. And then building management's going to be leading a whole upgrade and update on our roof. So we'll be very busy over the next year or so on some of those projects. So we don't have anything else in addition to that to request. So that's what we'll be working on in the next couple of weeks to get that into the city for the operating budget. Any questions or thoughts on that?
I don't know if it's related to this or just a general question, but maybe both. But do you expect any changes with the new mayor?
In terms of
I was gonna ask the same question.
In terms of everything, I guess.
So I know with any shift in leadership, right? Like they'll inevitably, be changes or but I don't know any specifics or anything or there's been no guidance, I know right now Mayor Rilling the charter changed. So in the past it used to be there was an election in November and then the new mayor would start, soon after that, but now I believe the new mayor starts at the beginning of January. So there's still time. So the thought is that Mayor Rilling is very much involved and guiding under his leadership this budget, this part of the budget process. And when Mayor-elect Smith joins, she'll be able to provide her input as well. But there's been no specifics with that. But so we're very much focused on maintaining what we have in the operating budget, right? That's what we're advocating for because we've spent years really working on enhancing and building the public health infrastructure and working really closely, with Lamont Daniels, our Chief of Community Services as well. So that's the focus right now, but there's been no specific guidance related to, the new mayor and changing leadership. But I know as council president, I know Mayor-elect Smith has always been very supportive of community services as a whole and of the health department.
Would it be helpful to get on her calendar with a presentation from either the board or yourself? Even some way of connecting us and the city to the budget, because obviously that's where it falls, and we don't want to be affected by others. We want to make sure we keep our own. But I think we have a couple of presentations out there that are all world that you've taken on the road, and let her know that there's a great resource here that she shouldn't pass up.
I'll reach out to Lamont about that. Yeah, I'll suggest that if everybody. Yeah, I know we're also fortunate. She was the former chair of the Community Services Committee of the Common Council too. So, so I know she's definitely interested in our work. And supportive. Yeah, I'll reach out to Lamont. I'll keep you all posted. Anything else? All right. Hearing none, we can adjourn unless there's nothing else. All right. Have a happy holiday season.
Good holiday, everybody.
Take care.
Happy Thanksgiving.
Happy
Happy Thanksgiving.
Adjourn at 8:25.